This video is for basic facial. So we're gonna start this video as if we have just arrived at work. So when we get there, the first thing that we always wanna do is wash our hands. So we are gonna wet our hands at the sink and find liquid hand soap. We're gonna wash our hands down to our wrists. We're gonna wash the back of our hands down to our wrists. We're gonna wash our fingers. We're gonna wash the backs of our fingers, between our fingers and our thumbs. We're gonna wash our fingertips and nails, thumbs. We're gonna wash our wrist. All of this wash will be super thorough for 20 or 30 seconds minimum. And then we're gonna rinse everything thoroughly, properly underneath the water. When you feel like that's properly cleaned, you will grab a disposable paper towel and you're gonna turn off the faucet, completely dry off your hands, and then you're gonna go ahead and toss the disposable paper towel in the trash. You will then find your hand sanitizer, 70% ethyl alcohol, and you're gonna sanitize your hands. And I just thought of one other thing. No, you know what? I can use 2x2s for it. That's fine. I've got everything I need. Okay, so then you've got to talk about preparing your room for your service. So let's talk about what's going to happen to get ready for your client before your client arrives. So we are going to disinfect our workstation, bed, and equipment using a disinfectant wipe and following manufacturer's instructions. You want to check your equipment to ensure that all devices are in safe working order and plugged into a working receptacle. You're going to gather clean supplies needed for the facial service, storing in a clean, closed container. You're going to turn on the hot cabbie and stock with at least 3 clean, wet towels. More may be needed depending on the service and the client's needs. You will fill a clean steamer glass with distilled water and preheat the steamer. You'll dispense products needed for the service according to skin type and client's needs as follows. You will prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with a disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula, something like this. Close the lid to the product and set the portion cup tray on the tray. You're going to drape your facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Placing the clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. You'll lay a hairnet and a headband on top of the first towel, along with a rolled towel to support the head and neck of the client, and then save the 3rd towel to lay across the client's décolleté. So I'm going to show you everything that I've prepared ahead of time, assuming that I knew my client's skin type and what we were going to do. I could prepare everything and just not necessarily the specifics as far as like the product removal, but I could have all the cups out, all my tray ready, bed of course would be made. So let's talk about what I have. I have water, I have a makeup remover, I have astringent, so I've got some cotton rounds. Those will be used for my mag lamp. So I have 2x2s for things for my toner and makeup remover, etc. I've got 4 squares here. I plan on using some towels though as well for mine, some steam towels. I've got my disposable scoopers for product. I've got wooden tip Q-tips and gloves because that's what I'm going to be using for extractions. I've got a brush for my mask. So I have cleanser, I have exfoliant, I have massage mask, eye cream and moisturizer. So, and this is my toner. So we're just gonna pretend like I know my client's skin type before she actually arrives. So I've been able to prepare my portion cups. Otherwise, I would not be able to do that. I gotta have my cups out, my remover out, things like that, but I would not be able to do that. So, just noting that. And then I'm actually going to go meet with my client to have a client consultation. And when I have that client consultation, I'll find out if she can have the service, and then we'll talk about what happens next. So remember, I've washed my hands, I've prepared my room, I'm going to go meet my client. I'm always going to meet my client with clean hands. That's just a given. So you know that. I'm just going to turn the heat up. I'm sorry, y'all. I'm freezing. Okay. So we greet the client and we escort them to the work area. We determine the client's preferences. We assess the client's needs. We will assess the client's skin by performing a visual skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation like lice to prevent from safely performing the service. We will assess the client's consultation form for any medications and products used within the last 72 hours. We will consult on any known allergies. We will consult with the client on any facial surgeries within the last 3 months and if the client is under a physician's care. We will assess if the client is prone to cold sores or fever blisters. We will assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. We will assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from any of the contraindications that I've just mentioned, we can move forward with the service, and my client is just fine. So we need to get her ready before we wash our hands again. So what we would do is allow her privacy to change into her drape, and that she could get into the bed, and then we would come and tuck her in. So she has changed. She has gotten under the covers, and we are going to get her ready. So we've got our rolled towel here. We already have the towel horizontal. We're going to place this underneath her neck for extra support. We are going to drape the client. Beautiful drape here. And then we are going to go ahead and put on, we're going to put on a shower cap, not a shower cap, a hair net to keep the hair out of the face. Seems to work a little bit better for her than a headband. And that should be very nice for her. And then we are going to wash our hands. I'm just going to grab a couple more cotton rounds. The rounds, I'm afraid I'm going to run out of those in the facial. I'm doing this while she's resting comfortably, and I'm getting ready to wash my hands. Pretend like I already had all this done. We just want to make sure we've got what we need for this video. Okay, so it's time to wash hands again. So we're going to go to the sink and we're going to wet our hands, find that liquid hand soap, and we're going to wash them by rubbing down to the wrist. And we're going to wash the back of our hands down to the wrist. We're going to wash our fingers. We're going to wash the backs of our fingers. We're going to wash those fingertips and nails between our fingers. Between our fingers and our thumbs. Of course, we're going to wash our thumbs. We're going to wash our wrists. We're going to do all of that really good proper wash for a minimum of 20 to 30 seconds. And then we are going to really rinse it amazingly well underneath the water. When everything is clean, you can grab a towel or disposable paper towels, whatever with that hand. You're going to turn the water off. Completely dry everything, and then you're going to toss the paper towels into the trash. If you have laundry, you'll put it in a closed container until time to do laundry. And the last step for your hand wash, of course, is the hand sanitizer. So grab that. And then you're going to sanitize your hands thoroughly. And then first step here, of course, is eye makeup and lip makeup removal. So we are going to do that first. And some of our ladies are a little bit more glamorous and they have on a little bit more makeup, and that's okay. If that takes a little bit longer, just take your time. And then you'll be good to go from there. First thing that we're going to do is cleanse. And then you're going to remove that first cleanse. And we're going to do a skin analysis under the magnifying lamp. So what you're going to do is you're going to cover up your client's eyes because you're going to be turning on a bright light. And then you're going to take magnifying lamp and you're going to bring it over on top, or Woods lamp, and you're going to turn it on. So we're going to pretend like we just did that. And basically what we're doing now is taking a minute to do a really good proper analysis through that magnifying light lamp, where we can see more detail, maybe where there's excess oil, any kind of clogged pores, dehydrated skin, flaky skin, fine lines and wrinkles. We're looking for maybe hyperpigmentation, maybe anything that she specifically talked about. And it's also a really good time for you to notate so that you can put it in her file or his file, specific things about his skin, maybe some freckling, etc. Because if they become a permanent client, you're going to be the person, their skin expert, that is going to be letting them know. You'll be the first to see if there's any kind of change if they don't notice, because you're going to be looking under magnifying lamp, and then you can direct them to the proper person to see, the doctor to see. So you just want to make sure that you really give this appropriate time and care, and not only does it allow you to perform better in that service that day, but then also for what you want to recommend for aftercare, home care, because they're doing that every single day. They may only see you every 4 to 5 weeks. And then it gives you really good information to share with them so that you can tell them why you would recommend a service or a product for home use. So once you've done all of that, you can turn the light off and take the magnifying lamp out of the way, and then go ahead and remove these cotton rounds, and you can place them out of the way. And now you're going to go in for your second cleanse. So time for cleanse number 2. Go ahead and remove cleanse number 2. And now it's time for cleanse number 3. cleanse number 3. Not sure why this side always comes out, but it does. So once your cleanser's fully removed, we're going to tone. And I'm going to make sure when I spray my toner on that I do not allow the sprayer to come in contact with the 2x2s. The nozzle, I mean, so that you keep it, it's a sanitary thing. And then you're going to move into exfoliation at this point. So I'm going to get some exfoliation. I'm going to spread it around. I'm actually going to massage it in for 1 to 2 minutes. You can apply it with an implement like a brush, or something like that. It's up to you. You always want to avoid with everything. I'm just going to put this out there and say it again. You want to avoid the mouth, eyes, and nose. So if you would like to put cotton rounds over the eyes, you can, just to delineate that you are not going to get into the eye area. You can certainly do that. Okay, so we have finished massaging it in there, and we're going to go over what would happen next in the exfoliation process. So you would retrieve the steamer, facial steamer, which we do not have, so I'm going to talk about it, and turn the steamer on. You'll position the steamer next to the facial bed and make sure that it is facing away from the client's face, aimed, as the water heats up and emits an even outflow of a mist. So once the steamer is emitting that mist, you can position the steamer 16 inches over the client's face, aim it at the client's chin for even distribution on the face, and allow the unit to function for 3 to 5 minutes. So we would retrieve it and bring it over to the side of the bed, turn it on, but of course the unit would be facing away so that when it starts, the steam starts to come out, it would be away from your client. Once that's nice and steady, you're going to turn that towards her chin, and then the steam would come up and over the face, and you'll leave it there for 3 to 5 minutes. Because it's a video, we're not going to stay here for 3 to 5 minutes. We're going to pretend like we did that. So you would turn it away from the client's face, take it back to where you got it from, turn it off, and you'll leave it there until it's time to be disinfected. So we're going to remove her exfoliant now as if she had also had that steaming step for 3 to 5 minutes. So I don't have a cabbie, hot cabbie either, so I'm going to get my towel and pretend like it's from the hot cabbie. So shaking it out because it's really, really hot, I'm going to test the temperature on my wrists. Feels good to me, so then I'm going to test it on my my client's collarbone. Can you tell I'm tired? And then we're going to make the towel beautiful, and then we're going to wrap this nice, warm, steamy towel around the face, but we're going to leave the nostrils out so that the client can breathe. And we're going to press it in. And now once you have removed the exfoliant, the next step is extraction. So before you do any extractions, you have to put your gloves on. So make sure your hands are dry. So you can put on a pair of disposable gloves. And now we are going to remove our, we're going to do our extractions with, remember, the wooden tipped Q-tips. We're going to soak in astringent, and then we're going to toss. So you need to do that, pardon me, for each extraction you need to get a new set of these wooden tipped Q-tips. If you were to use a cotton round, in the fingers you would soak in astringent, you would use 2 cotton rounds, and you could kind of work your way around and then toss it, just for knowledge. So we're going to soak in astringent, and then we're going to go in for our extractions. And this part of your facial should never be more than 5 to 7 minutes because it could be painful. And so you don't want them to be uncomfortable for too long. So I'm getting a new set, soaking, and then coming back in. New set. Kind of methodical with this every little bit. She only has on her chin really, so this is gonna be the last one. She doesn't really have a lot of bad congestion in the skin, which is really good. So you're gonna toss those, and then you're gonna take off and toss your disposable gloves. Anything you use during that, of course, would be in the trash, and then you're gonna finish by toning. So once again, I'm gonna use 2x2s, and I am not going to let my sprayer touch my 2x2. So there's distance there. And the really good news is that after extraction comes massage. So this will be really nice for her after all that toughness. We're gonna get to come in with something gentle. So I'm just gonna get her massage product. And you wanna make sure you get enough of your massage product so that you don't have to go back in. Because if you would have to do that, it would be distracting for you and for your client, and this is the most relaxing part of the facial, something people probably really look forward to, and that you as an esthetician should be happy about, because it's a time to pamper them. I know it's my favorite part of the facial, for sure. I mean, I like it all, but I really, really like the massage part. It's very relaxing. to remove your massage product. And after massage comes mask. So we're gonna do our mask now. And when you're doing your mask, it's just like exfoliation. Everything else, you're avoiding the eyes, the nose, the mouth. And so at this point, you would follow manufacturer's instructions, but let's just talk about the mask real quick. You generally leave your mask on, depending on what kind of mask it is, for 5 to 10 minutes. So you're always gonna kind of wanna reference that and check to that. Just making sure that you don't over underdo. We are obviously working the video. It's not a real mask, so we are gonna go ahead and remove our mask step, pretending like it's been on the allotted time, of course. and after your mask, you're going to tone. And after that, it's time to get her ready to leave. So it's almost nighttime. What we're going to do now is add some eye cream. A little bit here. Applying on the ring finger, we're going to tap it on the zygomatic arch and the brow bone. So just a little tap, 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 gentle, gentle. And then we're going to put on her night cream so she doesn't have to wash her face when she goes home to go to bed. It's almost dark. And we will, when we close here in just a minute, we're going to talk to her about all the things that really matter, such as SPF, etc., etc. So I'm actually using a night moisturizer versus a day moisturizer. We did touch on SPF earlier when we talked about in her client consultation how critical it was. Number one cause of aging, all of that good stuff. So she was really listening. So we'll make sure she goes home with sunscreen, although right now she's not going to use it. This way she doesn't have to wash. She can just go home and go to bed and be comfortable with all of her gorgeous skincare on, because her skin looks amazing and feels amazing. She's going to be thrilled when she sees it. So we're going to get her out of here. So she's finished with her facial. We're going to give her some privacy and allow her to change back into her clothing, and she can leave the drape and everything because you're going to come back and clean up. Let's talk about what happens in closure. So you'll go meet with her out in the client area. We're going to get her checked out. Of course, we're going to go over any kind of maintenance and aftercare. You're going to get her booked for her next appointment, as well as make sure she's going home with the proper at-home treatment. Not just post-kit, but like things that she needs for every day, because remember, she's doing stuff every day. You only get to see her once every 4 to 5 weeks. Then we're going to go back because we have another facial coming in, so we need to get our room ready. She's thrilled. She's out the door. She's got her bag full of goodies. She's rebooked. We're going to discard single-use items if there are any left. We're going to place the implements, if we used any, in a closed container labeled to be disinfected. We are going to take all the linen, cape, sheets, everything that's going to go in a closed container to be laundered. And then we have to clean up and disinfect our work area. So let's find a proper cleaning agent, read manufacturer's directions. We're going to, of course, follow those directions for mixing and usage, wiping down our workstation, the bed, the area. With that cleaning solution, we're removing any debris. Then we need to identify a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting. You will definitely be putting gloves on for this, disposable gloves. Then you'll follow manufacturer's directions for mixing, or you can use appropriate aerosol disinfectant. You'll also disinfect electrical equipment and store it in a clean area separate from other implements, such as your steamer that you used, or magnifying lamp. And then it's time to wash your hands. So you're going to take off those disposable gloves. You're going to go to the sink. You're going to wet your hands, and you're going to wet them in the water. Find the liquid hand soap. You're going to wash your hands down to your wrists. You're going to wash the back of your hands down to your wrists. you're going to wash your fingers, and you're going to wash the backs of your fingers. You're going to wash between your fingers, your fingertips and your nails. You're going to wash between your fingers and your thumbs. You're going to wash your thumbs. You're going to wash your wrists. You're going to do all of that for a minimum of 20 to 30 seconds. And then you're going to give it a really good proper rinse under the water. When you feel like everything's clean, you can find disposable paper towel or clean towel. Grab it and use the towels to turn off the faucet. Dry everything thoroughly. If you used a paper towel, toss it. If you used a clean towel, it's now dirty. You need to put it with the other dirty linen with the lid on until you do the laundry. And then grab your hand sanitizer, 70% ethyl alcohol, and you are going to finish your hand wash with your hand sanitizer, as always. And then you can move forward to set up for your next client. So that concludes your video for basic facial.